Hey guys, continuing with the videos for the Adult Health 1 Exam 2, moving on to Chapter 27, which is Management of Patients, hi Jake, with Coronary Vascular Disorders. Alright, terms you need to know: Angina Pectoris, Ischemia, Myocardial Infarction, Stent, Sudden Cardiac Death, and Troponin. Let's bring out Quizlet. Alright, Angina Pectoris, this is chest pain, which may radiate to the left arm and jaw, that occurs when there is an insufficient supply of blood to the heart muscle. Back to patho. Ischemia, an inadequate blood supply to an organ or part of the body, especially the heart muscles. Myocardial infarction, or heart attack, results from sustained cardiac ischemia causing cellular death after 20 minutes and necrosis of the myocardium. A stent is a tubular support placed temporarily inside a blood vessel, canal, or duct to aid healing and relieve an obstruction. Sudden cardiac death is a non-traumatic, well, it's probably traumatic, but it's not due to trauma. A non-traumatic, unexpected death from sudden cardiac arrest, most often due to arrhythmia. In most instances, victims have an underlying heart disease. And then troponin is one of our cardiac markers, and it is the test of choice and appears 2 to 6 hours after a myocardial infarction and stays elevated for 5 to 10 days. All right, moving on. Coronary artery disease, or CAD. It's the most prevalent type of cardiovascular disease in adults. Cardiovascular disease is the leading cause of death in the United States for men and women of all racial and ethnic groups. That's pretty big. Coronary artery disease continued. Coronary Atherosclerosis. It's the most common cause of cardiovascular disease. It's an abnormal accumulation of lipid or fatty substances and fibrous tissue in the lining of the arterial blood vessel walls. It begins with injury to the vascular endocardium and progresses over many years. It may be initiated by smoking. Stop smoking. I did. You can do it too. Smoking, hypertension, and hyperlipidemia. The deposits called atheromas or plaques. Thrombus may the obstruct. Take out the. Thrombus may obstruct blood flow, leading to acute coronary syndrome or ACS, which may result in an acute myocardial infarction. Not good. Coronary atherosclerosis. Oh, I already said that. Anyways, it is an impediment to blood flow that is usually progressive, causing an inadequate blood supply that deprives the cardiac muscle cells of oxygen needed for their survival, known as ischemia. Angina pectoris, again, is chest pain that is brought about by myocardial ischemia, and a decrease in blood supply from coronary artery disease may even cause the heart to abruptly stop beating, known as sudden cardiac death, which is bad. Continuing with coronary artery disease. Prevention: 4 modifiable risk factors: cholesterol abnormalities and tobacco use. Again, quit smoking. Hypertension and diabetes. 4 elements of fat metabolism. You have your total cholesterol, your LDLs, and your HDLs, and your triglycerides. All right, for LDL cholesterol, you want it to be less than 100 milligrams per deciliter and less than 70 milligrams per deciliter for very high-risk patients. Total cholesterol should be less than 200 milligrams per deciliter. HDL cholesterol greater than 40 milligrams per deciliter for males and greater than 50 milligrams per deciliter for females. Remember, your HDLs are your good ones, your LDLs are your bad ones. And then you want your triglycerides to be less than 150 milligrams per deciliter. All right, dietary measures. You want a diet low in saturated fats, high in soluble fiber, adjusted for individual patients who have other nutritional needs. So an example of one of these diets would be like a Mediterranean diet. Mediterranean diet promotes vegetables, promotes fish, restricts red meat, and reduces mortality from cardiovascular disease. All right, management of an elevated triglyceride level focuses on weight reduction and increased physical activity. Regular moderate physical activity increases HDL, increases the good ones, and reduces triglyceride levels. If diet alone cannot normalize serum cholesterol levels, medication can have a synergistic effect. Lipid-lowering medications can reduce CAD mortality, so that's good. All right, Again, cigarette smoking contributes to the development and severity in coronary artery disease in at least 3 ways. Nicotine acid in tobacco triggers the release of catecholamines, which raise the heart rate and the blood pressure. Nicotine acid can also cause the coronary arteries to constrict. Smoking can increase the oxidation of LDL, damaging the vascular endothelium. And this is 4 ways. Inhalation of smoke increases the blood carbon monoxide level and decreases the supply of oxygen to the myocardium. This is bad. Stop smoking. All right. Angina pectoris. Heart pain. There's a very small, cannot read it little thing about it right there. All right. So angina pectoris or chest pain is caused by insufficient coronary blood flow. It can also be caused by atherosclerotic disease, and you have different types of angina. You have stable angina, unstable angina, intractable or refractory angina, variant angina, and silent ischemia. All right, stable angina. This is predictable and consistent pain that occurs on exertion and is relieved by rest and or nitroglycerin. That's stable angina. Unstable angina, which is also called pre-infarction angina, so unstable angina, warning sign of impending heart attack. Symptoms increase in frequency and severity and may not be relieved with rest or nitroglycerin. Unstable angina, very, very bad. All right, intractable or refractory angina is severe incapacitating chest pain. Variant angina, which is also called Prinzmetal's angina. You're going to have pain at rest with reversible ST segment elevation, thought to be caused by coronary artery vasospasm. That's variant angina. Silent ischemia. Objective evidence of ischemia, electrocardiographic changes with a stress test, and reports no pain. All right. What might cause the symptoms of angina? Okay. Physical exertion, exposure to cold, which will cause vasoconstriction and elevated blood pressure, eating a heavy meal, stress or any emotion-provoking situation. So basically, all of us in nursing school have angina or could have angina. Very stressed. Typically, the pain or discomfort is poorly localized and may radiate to the neck, jaw, shoulders, and upper aspects of the upper arms, usually the left arm. Patients will complain of a feeling of tightness or a heavy choking or strangling sensation that has a vice-like insistent quality. They may complain of a weakness or numbness in the arms, wrist, and hands. They may have shortness of breath, be pale, diaphoresis or sweating, dizziness or lightheadedness, nausea and vomiting, which we see with everything. Medical management of angina. You want to decrease the oxygen demand of the myocardium and increase the oxygen supply. Some medications for angina, you're going to see nitroglycerin, beta blockers, calcium channel blockers, antiplatelets and anticoagulants, and again, oxygen administration. All right, acute coronary syndrome and myocardial infarction. These are emergent situations. Acute onset of myocardial ischemia that results in myocardial death if definitive interventions do not occur promptly. Plaque rupture and subsequent thrombus formation result in complete occlusion of the artery, leading to ischemia and necrosis of the myocardium supplied by that artery. A vasospasm, or a sudden constriction or narrowing of a coronary artery, decreased blood oxygen supply from acute blood loss, anemia, or low blood pressure, and increased demand for oxygen from a rapid heart rate, thyroid toxicosis, or ingestion of cocaine are other causes of acute coronary syndrome and myocardial infarction. All right, so with acute coronary syndrome and myocardial infarction, an area of infarction will develop over minutes to hours. As the cells are deprived of oxygen, ischemia develops, cellular injury occurs, and the lack of oxygen results in infarction or death of cells. There's a nice little picture right here. All right, so clinical manifestations of acute coronary syndrome and myocardial infarction. You're going to have chest pain that occurs suddenly and continues despite rest and medications. For the assessment, you're going to do, obviously, your patient history, an electrocardiogram, an echocardiogram, and a laboratory test for troponin, creatine kinase, so this could be your CK, CKMM, CKMB, and CKBB, and your myoglobin. All right, medical management for acute coronary syndrome and myocardial infarction. Minimize myocardial damage, preserve myocardial function, prevent complications, receive supplemental oxygen, aspirin, nitroglycerin, and morphine. That's your MONA. Beta blocker may also be used if dysrhythmias occur. Cardiac catheterization, possibly. Thrombolytics or fibrinolytics. And cardiac rehabilitation. Quickly, I'm going to do a highlight. Highlight the receive supplemental oxygen, aspirin, and nitroglycerin and morphine. We have to know that about MONA, or about myocardial infarction. It's one of our questions. All right. Invasive coronary artery procedures. This is known as a percutaneous transluminal coronary angioplasty, or a PTCA. This, again, we also need to know. So a balloon-tipped catheter is used to open blocked coronary vessels and resolve ischemia. And this is to improve blood flow within a coronary artery by compressing the atheroma. All right, nice little picture. A coronary artery stint. This is a metal mesh that provides structural support to a vessel at risk of acute closure. A stent is initially positioned over the angioplasty balloon. When the balloon is inflated, the mesh expands and presses against the vessel wall, holding the artery open. So, I mean, I would kind of know this stuff because it connects to the angioplasty, which we do need to be able to educate a patient about. Again, nice little pictures of them. You also have your coronary artery bypass. These are surgical procedures for coronary artery revascularization. So you have your coronary artery bypass graft, which is I always think of cabbage, but it's CABG. It's a surgical procedure. A blood vessel is grafted to a occluded coronary artery so that blood can flow beyond the occlusion. To be considered for, sorry, I'm calling it cabbage. To be considered for cabbage, the coronary arteries to be bypassed must have approximately a 70% occlusion. A vein commonly used for cabbage is the greater saphenous vein, followed by the lesser saphenous vein. A traditional coronary artery bypass graft, okay, so the procedure includes, you're going to get general anesthesia, you're going to have a median sternotomy, need a cardiopulmonary bypass machine. Your heart's going to actually be stopped. The patient needs to receive heparin to prevent clotting, and during surgery, hypothermia is maintained. And nice little picture of everything. Yay, last one. Again, traditional coronary artery bypass graft, nursing management, pre-operative education, important. Assessing the patient, reducing fear and anxiety, monitoring and managing potential complications, providing patient education, again, that's pretty important, maintaining cardiac output, promoting adequate gas exchange, maintain fluid and electrolyte balance, relieve pain, maintain adequate tissue perfusion, and maintaining normal body temperature. All right, and that is it for Chapter 27, Management of Patients with Coronary Vascular Disorders. On to Chapter 28 in the next video.